Hello and welcome to Health Professional Radio. I'm your host, Neal Howard, for this Health Suppliers segment. Thank you so much for joining us today. Our guest in studio today is Mr. Graham Magee, Director of Sales and Education for Indica, a company in Scandinavia who's expanding here in the United States. And I'll let him tell you all about this company and what it's involved in. Good afternoon, Graham.
Good afternoon, Neal. Thank you for having me.
Thank you so much for lending us some of your time. What exactly is Indica, and what type of player is Indica in the hemp oil field as it stands today?
Yeah, it's a great question. So I'll start with a little bit about how our company was founded, and we always like to speak about our Indica founder, Henry Vincenty. So Henry comes from a biogenetic and more of a technical background with chemistry and the genetics of the plants. So what he decided to do is take his studies and use it for the better of the world, greater good.
Many of our listeners are healthcare professionals themselves, but for the benefit of, folks like myself who don't necessarily understand or realize the differences between, the marijuana that we all see that's, glorified in the news and in movies, and the hemp oil that seems to be the hottest topic going when it comes to the relief of many maladies.
Yeah, it's definitely in the mainstream now, or at least getting into the mainstream with a bunch of medical doctors and professions like naturopaths, Ayurvedic doctors, massage therapists. The only issue is there are strong legalities against calling it a medicine at this point. We'd like to concentrate more on a food.
So what is the difference between marijuana and hemp oil, or these oils that these CBDs? And I'm not sure I understand what CBDs are either.
Yeah, and that's a great question. And one of the biggest mistakes that people make is they immediately think that these are two different plants, when in fact they come from the same genus of plants, which is Cannabis sativa L. Mm-hmm. So they are the same plant. It's the same family. It's like you have different tomatoes, you have different apples, you have different cannabis plants.
Okay. Well, good clarification. What type of danger when it comes to, I guess, getting high or having your senses altered, much like alcohol or the effects of marijuana when it's smoked or eaten?
So CBD itself, cannabidiol, is considered non-psychoactive, and THC is really what gives you that psychoactive high, if you would call it. And we are under the legal limit for import, and at those levels, it's very, very tough for someone to have that effect.
You mentioned your founder. How long has the company been here? Has it had a presence in the United States, being in Scandinavia?
Yeah, so the company's been around since 2006 worldwide, and we really just started concentrating on the U.S. market about a year and a half ago.
Was there always the intent to focus on the U.S., or were you in Scandinavia because of legalities and now things have changed?
I think the intent was to always come into the U.S. market because it is a major market worldwide, and the legalities have changed since we first stepped into the game here, but I think they're going in our favor, which is a good thing. Worldwide, there are very different legalities, so it does make it easier, and in some cases harder for us to work in specific countries, but I think the U.S. is one of the bigger markets that we are focusing on today.
In focusing on this huge market, surely you're not the only producer of these CBDs. What guarantees that your quality is going to be better suited, in this market, being the biggest market?
It's a great question. So what happened was, back 2 years ago, maybe 3 years ago at this point, there was just an influx in the market with people trying to get involved because they realized the profit margins of this specific cannabinoid. And that brought a lot of players into the game, and the issue was quality. So what we wanted to do is we wanted to give consumers an even playing field of having great quality, but for a reasonable price as well. So we pride ourselves in our quality. We control everything from the seed to the soil, which is very important and goes overlooked in most cases, to our labs, are all GMP and ISO certified, and we control those steps every which way. So we're organic certified as well. That's one of our biggest features at Indica. We're one of the world's only certified organic hemp suppliers, which is a huge advantage on the rest of the market. And just our quality, we feel, stands above the rest when it comes to other sources.
You know, you mentioned organic. What about the packaging? As far as, you know, using recycled materials, going green, maybe recycling even some of the remains of the harvest. Does Indica become involved in any green endeavors?
Yes, and that's one of our goals at Indica. We're not just a CBD supplier. We believe that this plant was put on this planet as a superfood, as a super plant, not only for food but for textiles, for concrete, for homes. It's antifungal, antibacterial. It's great for nutrition as well. So, for instance, we take our waste and we're making food with it. We're making breads. We're making dog treats.
Really? Dog treats?
Yeah, we're going all over the map with it. And, you know, one of our newest arrivals to the Indica family is our CBD chewing gum. And this is a little tease on that because it's not available yet, but will be soon. It's an eco-friendly gum, so it's going to actually be 100% biodegradable, which is, you know, unheard of for gums.
What about as supplements? You know, we take supplements, vitamin D on a regular basis, or this or that. Do you have amounts in capsule form as a supplement to take with other supplements?
We do have a capsule at Indica. We our tinctures are our bread and butter. But our capsules are quickly becoming a fan favorite because of the ease of use. And our capsules contain 10 milligrams and 50 milligrams. So we have two different levels of strength there.
Where can our listeners go online and check out Indica USA's presence?
They can go to indica.com and check out our sites, our new products. We have a lot of news up there. And one thing that's unique with Indica is we actually show every batch we make. We make our COAs, which is our tests, available for everyone to see. So that's something that's very unique that sets us apart as well.
And there are some questions that I've asked you today, you know, out of curiosity, like, you know, anyone going. Is there an area where they can, you know, just say a frequently asked questions area where, you know, the basic questions that you encounter when you're talking about it, someone who wants to learn more, is there something that kind of lays out the basics for them there as well? Yeah,
we do have an FAQ section there that, you know, people get into a lot of questions on how to take it, you know, like we touched upon, will this get me high? Is this marijuana? Basic questions like that to user questions, which can come up as how much do I take? How often do I take it? And it really is based on the person. So what we suggest is half a dropper a day or a capsule a day in our tinctures and caps. And based on how you feel, you can either increase or you can decrease.
Congratulations on your expansion into this wide open market in the United States. You've been listening to Health Professional Radio. I'm your host, Neal Howard, for this Health Suppliers segment. We've been in studio talking with Graham Magee. Graham is the Director of Sales and Education at Indica. Well, Indica USA now, expanding further into the United States market after having been founded in Denmark in 2008. Indica's primary focus is to research and develop innovative hemp extracts and to make them accessible worldwide. And according to Graham, they are well on their way. It's been great having you here with us today, Graham.
Thank you for having me, Neal.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. And you can subscribe to this podcast on iTunes.